Hey, Diane, thanks for meeting with us today here at Tender Care. You're one of the more seasoned nurses here. You've been around for a long time and, of course, been a nurse for many years.
Yes.
And I'd just like to ask you, what are your thoughts on the kids here and the nurses here and what you do every day?
Well, I have to say I've been a nurse for 25 years. I started off in elderly, and I did that for a year, and ever since I've gone to pediatrics because for these children, I just feel like a lot of people do shun them, and just throughout history, they've
Mm,
always been looked at aside. And I really want them to be integrated and feel like they're part of our world, and I want them to feel included and I want them to feel special. And if I can make them smile and feel loved for the time that I'm here with them, then I feel like I've done my job.
Oh, that's wonderful. That's wonderful. Do you feel that any nurse that wants to get into pediatrics, because like we were discussing earlier
Yes.
off camera, a lot of nurses want to get into oncology, they want to
Right.
get into surgical nurses, things
Hmm.
like that. What does it take to be a nurse working in pediatrics in this kind of environment?
I think you just basically have to love children and just love seeing progression. Seeing
Hmm.
progression. It doesn't even have to be in their health because some of the children have terminal illnesses,
Sure.
but just progression in the sense that they're feeling happy, that they're feeling at ease, comfortable, loved,
Yes.
that they get the sense of touch. I think that's very important with us to
Mhm.
hold our babies and touch our children that are older, even. Um, but with the times changing, we did require some type of pediatric
Yeah.
experience, either even babysitting. But I think that now with the times changing and the scarcity of
Hmm.
nurses, I believe that they are making accommodations. So I encourage any nurse to apply
Oh,
and
absolutely.
put down any type of experience, even if you're a mother yourself. I feel like that counts as experience
Sure.
too. So even that, I encourage anyone to come. I don't even. I just if you just love children, if you just love to play, I feel like that's a good start.
And what better feeling as a nurse than to, as I'm sure all nurses feel, but with pediatrics,
Yes,
doing something that's bigger than yourself and
absolutely,
and going home every day with the feeling, like you were
absolutely,
saying, kids that come in and you see their progression. We were just speaking
absolutely.
to a physical therapist there, and she was just telling us about how she comes once every month or so, and then
Right.
she looks at her chart and
Yes.
just sees how much they've progressed
Mhm.
in their
Yes.
therapy. It's just a
Yes.
wonderful, wonderful thing that they do here at Tender Care. And
It totally is.
sure, sure,
Yes, it's amazing. I know I can think back of many kids, but there's one in particular who came here, a beautiful child, was nonverbal and non-ambulatory. She didn't
mhm,
walk. And she is walking and talking and everything now. So it's
oh
amazing to
wow,
have seen that she came without being able to walk. And I knew that my therapist was going to be able to get her there. I just knew it from the beginning. And it's such a good feeling to know that your thoughts and your hopes for this child
hmm,
has come to
hmm,
fruition. That's an amazing feeling, not only
sure,
for us, but what a great feeling for the kids. Like a teacher with their children that they advance. It's the same feeling.
absolutely.
Even with my own, they just feel like my own kids. If they move forward, if they advance in the smallest of ways, I'm proud.
Yeah, having coming from a family that has a nephew that's developmentally disabled, my heart goes out to
Mm.
everybody on the front lines that are in the classrooms with these
Oh
kids
yes,
and have an opportunity to come and tour it and things like that.
they're a blessing.
It's such a blessing and a
They
certain amount
are.
of empathy and
Yes.
compassion
Well, they
that the
teach
nurses
us.
have.
Yes, they
Sure.
teach us too, because it's a hard world out
Oh,
there.
absolutely,
And
absolutely.
when you go out into the public, you may not always get a smile, and you may not always get a genuine and sincere hello,
Sure.
but when you look at these children, it makes me want to cry
And
because
sometimes that's all they need,
yeah,
right?
you
Just a
just look at them
smile
and you
and
smile
a
at you. You
touch.
know it's sincere. You know that
Sure,
they love you. You know that they admire you there for them. So it's just so
sure.
important. It's such a great feeling.
Absolutely.
Yeah.
Well, I'd like to thank you
Thank
for everything
you.
you do here with the
Thank you.
kids. We need so many more of you here. And just the compassion and empathy that you show and every other
Yes.
nurse shows here is
Yes.
just a wonderful thing. So
Thank you so
we
much.
really appreciate it. And I know the kids absolutely appreciate that and
Oh,
their
we love
families as
them
well.
too. Thank you
Yeah,
so
you're
much.
very welcome.
Thank
Thank you.
you.
Harley, Thanks for talking with us today. Tell us a little bit about what you do here at Tender Care.
I am a physical therapist. I treat the kids for their gross motor impairments. I come in and do the evaluations and see where their impairments are and see where I need to set goals to get them to their next steps.
Ah, okay. So it's so wonderful. I was in here earlier and I was watching you work with the kids, and I got to tell you, it's a wonderful, beautiful thing what you're doing with them. And you said something really interesting earlier that's been running through my mind as we tour the facility. How you, every time you come back, you see the progression of these kids.
Yes.
What do you think that has to do with? Why do you think that what they do here at Tender Care and what obviously what you're doing has such a huge impact on the kids and their progress?
Well, it's a wonderful facility where they have nursing and they have therapists who are in here. So children who typically get therapy, they're going to get it once or twice a week for maybe 30 minutes to an hour. Here at Tender Care, they're getting nursing services all day. They're then having therapy services multiple times a day. So the interventions are much more intense here. So they're able to meet those milestones much quicker.
Wonderful, wonderful. So tell me what a normal, typical day looked like the child you were working with earlier today. They come in, do you kind of like give them physical therapy or walking or motor skills? What does your typical day here look like?
My typical day here is that I'm going to come in and see which kids are here, and then I'm going to see which ones need evaluations. When they come in, they're bussed here in the morning, which is a wonderful thing for a parent because they don't have to take them. And then when they come in, the nurses assess them. They see where they're at. They give them all their food here, the morning, the breakfast and the dinner, or I'm sorry, the lunch. So it's wonderful that they're getting all this care, whereas at a daycare, they may not be getting that personalized care for their medical condition.
So tell me, last question. So what does it take for someone, a nurse, whether it be a physical therapist, to really, because, you know, a lot of the physical therapists, they want to get into, you know, the sports medicine and things like that. So in terms of working in an environment like this with the children, we have to do something that's, you know, kind of bigger than we are. So what does it take, do you think, to be successful, I guess you can say, or get that same kind of feeling that you feel when you're working with these kids every day?
I'm going to say for me, it takes being compassionate and kind of understanding the children, having the passion and seeing them when they come in and they're not able to even sit up on their self, then getting them to that next step. So you have to have the drive and you have to be able to tolerate children. That's a big thing. I love children. I'd have as many as I could, but you know, here I get to play with them. So you have to kind of be able to get down on their level. And I think that's really important in being able to play with them instead of just kind of standing next to them. So you've got to put therapy in a different spin. It's got to be more play-based. I can't tell a child, lift your leg up 2 times. They've got to be able to do it, you know, okay, let's go marching. Let's go do some stairs in the playground. And it's more
hands-on kind of interaction as well too, and building the trust up with the kids. I'm sure it's a trust issue as well.
Yes, it is.
Sure.
Oh yeah, you gotta have those playful voices so that they want to come and play with you. And I'm thankful when I come in here, I make connections that the kids don't have stranger danger when I come in.
That is absolutely wonderful, and I appreciate talking to you today.
Always.
That's fantastic. We need about 100 more of you every day.
Yes, please.
Absolutely.
Yes, the pediatric profession, we need as many PTs or PTAs or CODAs, as many therapists as we can to come in.
You guys heard it. We need as many as we possibly can. So it's a wonderful field to get into. And how fulfilling is it? Every day you can go home and make a difference in these children's lives. So that's always a wonderful thing, and I appreciate speaking with you.
Wonderful.
Thank you very much. And who's our friend today here?
Yeah, Lily. Lily, you want to say hi?
My daughter's name is Lily. What a pretty name that is. Good cereal, huh? So Melissa, tell me a little bit about what you do here at Tender Care.
So I help with education. We have teachers come from Hernando County and with a program called Hospital Homebound. So kids will be able to receive school here. They get language arts, math, social studies, and science, and then the high school kids will get some electives as well.
Oh wow, what an interesting program, and that's hosted through Hernando County?
Yes.
The school board?
Yes.
That's a wonderful program. And teachers come in how often?
So we have teachers, right now we have extended school year for the summer, and I have a teacher here 3 days a week.
Oh, wow.
But normally during the regular school year, we'll have teachers come 5 days a week.
That's fantastic. Is that something that's the norm in a PPEC, that they have training, or is this like an offering, or is this just something?
So it depends what county they're in. For instance, Hernando County, they offer their hospital homebound program during the day, where I know that Pasco County, their hospital homebound program is in the evening. So we have kids that come from Pasco that will get their services through Hernando County School, because if they were in Pasco County, they would have to do it in the evening time.
That is wonderful. That is wonderful. So you pretty much work in lockstep with the teachers that come in?
Yes.
Okay.
So we have 2 different teachers that come in. The one teacher will do language arts and social studies, and then the other teacher will do math and science. And the kids will get an hour of the core subjects, like math and language arts, and a half an hour of the social studies and science.
Oh, good. So they're getting the physical care and the therapy, and then getting their education as well.
Yes.
And getting picked up and dropped off at home. So
and all
it's
meals
pretty
are
much,
provided
and
as
all
well.
meals are provided. That's absolutely wonderful. As our good friend Lily here is enjoying her cereal. So tell me, in terms of what you do, what does it take for somebody to come in and be able to help these kids and assist these kids in their situation, in what they're doing? What type of person does it take to work in an environment like this?
Well, I think you have to be patient and kind and loving, and you have to realize that that everything looks different for every child. So I don't know, a kid answering yes or no is huge here.
Yes.
Where someone else may think, oh, that's not a big deal, I just said yes or no. So you have to realize that every little step is a giant step for these kids, and we celebrate everything that they do. So,
absolutely.
I'm sorry, I get like
no, that's fine. We were just having a conversation with another nurse as well that felt the same way. It definitely takes someone with a lot of compassion and a lot of empathy, and really, and I've been saying this in everyone I've been doing something bigger than yourself.
Oh yeah.
I mean, really, and going home and really kind of hugging your kids, because life could be so much different.
Sometimes I say when I leave here, I feel like I wore a superhero cape.
Sure.
Not always.
You do.
So,
all of you do.
But because I don't know, you see what we can help these children accomplish. So it's very rewarding.
Good.
Humbling too.
Good. I'm glad to hear that. And Melissa, you're doing great things here, as everybody else at Tender Care here is doing, all the staff and taking care of these angels here. And I'm sure we can all say we appreciate and love everything you guys are doing. So thank you very much for talking to us. And thank you, Lily. Can you say thank you? Say you're welcome. Okay, she's full. But thank you, though, Melissa. I appreciate everything you do. Thank you. Hey, Ashley, thanks for sitting down and talking with me today.
Yeah.
Lot going on around here
always
today.
Busy.
Always busy. So tell me a little bit about what you do here at Tender Care.
Okay, I am a nurse here at Tender Care. I've been here for about 8 years, so I have put in a good deal of time here. I really love what I do. These kids are special, so it's easy to come to work every day.
Yeah, I see the enthusiasm and the compassion in your face when you talk about being here for 8 years, because that's a huge commitment. I mean, these kids are compromised
and complex,
complex. So it takes a very, very special nurse to do this. So tell me what gives you that kind of energy to come in every day for 8 years with these kids.
Again, they're just each child has their own unique personality, and they're just they bring a certain light. You'll gain a relationship differently with each child. So certain children will run up to you and, I love you, Miss Ashley, and they're happy to see you. And again, it's really easy walking into a room like that.
Wonderful. So you could have been a lot of different things, right? You could have, you're a nurse. You could have worked in surgical, oncology, and all these other kind of, what brought you to pediatrics, specifically to
Pediatrics is always something that I've wanted to do since I was a kid. I knew I wanted to work with kids. I worked with special needs kids when I was in high school. I volunteered, did those different programs. So that's kind of what led me to seek out a job like this. It's something I've been interested in a long time.
Wonderful, wonderful. So what could you tell any new nurse, right, that's looking, because I come across so many new nurses and they, they have all these things they want to do, but it really comes down to finding your niche, right?
Right.
So what does it take?
Patience. Pediatrics, patience.
We've heard a lot of that
You have
today.
to have patience to work in pediatrics. But and at the end of the day, it's worth it. It's you feel good at the end of the day. You know you've done a good job for these children, for their families.
Sure.
Sometimes you just have to try something new, something you didn't think you would want to do originally, and you might find that
you've fallen in love with it, like you
might
have,
find
right?
that you just fall in love with it.
Wonderful. That's awesome. Well, I appreciate you telling us about your experience here at Tender Care and how long you've been here. You're kind of a seasoned nurse here.
Yes.
Yeah. So I'm sure you've seen a lot of kids that have come from here to
young adulthood.
Done amazing things.
Yes.
Yeah.
Yes.
You guys do wonderful things here. So I'm sure, just from me, thank you. And I'm sure everybody else thanks you for the amazing work you do here with these kids. What would we do without you nurses that can come in here in a pediatric setting like this and really make a difference in these kids' lives when they can't do any better for themselves?
Right.
So thank you for that, and I appreciate
you're
it.
welcome.
Thank you.
Yes, thank you.